everybody. I am Dr. Radhika Meka, gynecologist and IVF specialist from Parampara Fertility and Gynaec Center, Kilpok, Chennai. Today we'll be discussing frequently asked questions by the patients during the corona times. Yes, we have opened up our fertility clinics and looking forward to start our treatments. So, with all the precautions from our side and your side, it is safe for us to go ahead with fertility treatments. To prevent the spread of coronavirus, you should always be wearing a mask, maintaining the social distancing and follow the hand hygiene. You should be washing your hands at least for 20 seconds. And apart from that, avoid crowded places and avoid travel. So with all these precautions, we can go ahead with the fertility treatments. We are also from our side spacing our appointments so that we don't have a crowded waiting area. So we advise you to stick to the appointment timing and come. We would also advise you to inform us if you have any fever, cold, cough or sore throat. Before we start treatment, we usually check the COVID testing and then start treatment. So if it is a frozen embryo transfer, that is, we've already collected your eggs, made embryos and frozen them, then unfortunately we might need to cancel the cycle. If you're going for an egg collection and started injections just a few days back, then probably we would be cancelling the cycle because you might develop fever, which is quite detrimental for the egg quality. But if you are towards the end of the stimulation, then we might give you an option to go ahead, keeping in view the money and the time spent for the treatment. We would take all the precautions for COVID-19 during the egg collection procedure. And once we finish the procedure, we would isolate you and start the COVID-19 treatment. Still, it is a new virus. So lots of studies are going around, so hopefully we would know in the near future. So pregnant women do not appear to be at an increased risk compared to a non-pregnant population. But what we have to understand is pregnancy is an immunocompromised state. So these patients, these ladies are in the vulnerable and high risk group. So they have to take extra precautions and extra care in the COVID-19 times. We have reports that COVID-19 pneumonia has been mild and the recovery rate is very good. In the first trimester, we have seen a slight increase in miscarriages, abruptions and early deliveries. But all these are very few cases. We cannot come to any confirmatory conclusions regarding that. As of now, what we know is the virus is not teratogenic, which means that it doesn't cause any big malformations, congenital malformations to the baby. So it is not an indication for termination of pregnancy. So the women need not terminate the pregnancy if they are infected with coronavirus. So vertical transmission is transmission of coronavirus from the mother if she is infected to the baby. So this is possible but still not confirmed. There is no contraindication for breastfeeding. You can continue breastfeeding, but you have to take the safety precautions like wearing a mask and maintaining hand hygiene, washing before and after feeding. But if you're still worried, you can express milk and ask the attendant to feed. You have to isolate yourself from the baby for about 14 days.
Once I see the patient, I explain that IVF-ICSI is the best treatment for them. They are put to my counselors. Our counselors are very well experienced in taking care of infertility patients. So what they do is they first sit with the patient, they discuss their problem, they make sure that they understand their problem. It could be like a polycystic ovaries, they are having ovulation problem, or they could have endometriosis or adenomyosis, or even we are doing ICSI for a male factor. They sit with a couple, make sure they understand the problem, then they explain about the IVF-ICSI procedure. When they have to start the injection, they are also free to ask any questions regarding the procedure. So everything in detail is explained. So ellame small issues also are discussed with the couple. So it could be like what happens to the eggs, how the embryos are created, or afterwards how embryo transfer avanga eppadi irukano ellame avanga kekkalam, and these counselors will be very glad to answer them. So even the success rate is explained to them. எல்லாருக்குமே நம்ம ஒரே சக்ஸஸ் ரேட் சொல்ல முடியாது. Each couple rate have their own success rate. So our counselors discuss with them their success rate, so they're mentally prepared. ஸோ எங்களுக்கு இவ்வளோ சக்ஸஸ் ரேட் வரும், ஃபெயிலியர் ஆனால் என்ன பண்ணலாம் எல்லாமே டிஸ்கஸ் பண்ணியிருப்போம். ஸோ எம்ப்ரியோஸ் நம்ம எடுத்தோன்னா யாருக்கு ஃப்ரீஸ் பண்ண போகிறோம், யாருக்கு ஃப்ரெஷ் ட்ரான்ஸ்ஃபர் பண்ண போகிறோம், ஆல் த ஃப்ரெஷ் அண்ட் ஃப்ரோசன் ட்ரான்ஸ்ஃபர் ப்ரொசீஜர்ஸ் எவ்ரிதிங் இஸ் எக்ஸ்பிளைன் டு தெம். அண்ட் ஒரு அப்பாயின்மெண்ட் இல்லை, திருப்பி அவங்க 2-3 அப்பாயின்மெண்ட்ஸ் எடுத்து வரலாம். ஒன்ஸ் தேர் கன்வின்ஸ் வித் த ட்ரீட்மெண்ட் வி கோ ஹெட் வித் த ப்ரொசீஜர். வி ஆல்சோ கிவ் த கப்பல் our 24 hours helpline, which they can contact us anytime. I personally get in touch with our counselors and we discuss and they update me about the couple. IVF பண்றவங்க மட்டும் தான் கவுன்சிலிங் இல்லை. even a small treatment like a follicular tracking a lady might have or an IUI she might be have, still we refer them to our counselors. because ஏன்னா the counselors வந்து உட்கார்ந்துட்டு பாசிட்டிவ் மைண்ட் எப்படி ட்ரீட்மெண்ட் போனப்போ வச்சுக்கிறதுக்கு they will help them. so when they come with a positive mind, the results what we have seen are much better. At the end also we add a note that in case negative aachina enna pannalam, they shouldn't think it's the end of the world for them. Negative inda kuda we have lots of advanced fertility treatment available at our center. So they really need not worry, because all the advanced fertility treatment are available at Parampara Fertility. So you can just contact us, avail our services. Thank you.